Knon 89.3 FM in Dallas and Fort Worth, the voice of the people.
Business owners, tell KNON's listeners about your business. You can put your business or event on KNON. KNON currently has space available to run announcements for you. Tell KNON's listeners about your goods, services, nightclub, concert, or event. Help keep the voice of the people on the air while putting your information on the air. KNON's been named the #1 radio station in Dallas by both the Dallas Observer and D Magazine. Put your business with Dallas's #1 station. Call now for more information at 214-828-9500, extension 227, or extension 233. For more information, go to KNON.org and click on the Run Spots on KNON page. It's a great way for your business to support community radio while letting more people know about you.
And good afternoon and welcome to Lambda Weekly. I'm Dave Taffet and I am here in the studio with the late Patti Fink. Our guest today is John Carlo. He is the Secretary-Treasurer of the Dallas County Medical Society. He's the Executive Director of AIDS Arms. He's the incoming Surgeon General of the United States and
certainly of Dallas.
Of Dallas, yeah. We're going to talk all kinds of medical issues today, not just AIDS stuff, but all kinds of wacky medical stuff, like, you know...
Like women, pregnant women are simply hosts?
Something like that, yeah. That was a good little news story I just found this week that I had posted. Some of these right-wing...
The good doctor is like looking askance at me.
That wasn't on the script.
No, it wasn't. So, Patti, you just got back from 2 weeks in the Caribbean.
Yep.
Where you missed your boat. You ended up having to charter a helicopter, have them fly you out with your luggage. They landed you on the deck of the ship in the middle of the Caribbean. But after that, how was your cruise?
It was fantastic.
Well, that's good to hear.
No, it was really great. We were sailing, and I've been sailing with my sister and brother-in-law.
This was a private cruise.
Right.
They chartered their own ship.
Yeah, we bareback cruised. But we had a skipper. Every boat has to have a skipper.
Mm-hmm.
And with some great friends from the Caribbean that we've
Did you
known
have a
for
Gilligan
25
too?
years. No.
Just a skipper.
Just a skipper.
Oh.
Yep. So we had a great time. Sailed from Antigua to Dominica, and so it was really, really nice.
So how much of the cruise did you miss?
Well, actually, they went for a full 2 weeks. I went for 10 days. So
because it was 4 days late that you got there.
I guess, yeah. I met them on Antigua.
Every week when we post and the late Patti Fink, I get, oh my God, what happened to Patti? Nothing. She was late. It's just Patti.
It precedes me, of course, because I have to catch up.
Patti calls just before the show, on schedule, 1:45 every day. I answer the phone, hi, you're running a little bit late. She calls me during the week about stuff. I answer the phone, I see it's Patti, I answer the phone, hi, you're running a little bit late.
You can't help it. 15 years and then you can't stop it.
It's just the way it is. We are talking to John Carlo. I saw John during the week, and there's been lots of medical stuff going on, and I thought, you know what? We haven't done a good medical show in a while. Done some bad ones, but no. We always do a good medical show. We haven't done a medical show in a while, and I wanted to talk about a couple of things. The issue that it really pisses me off, because my mother was a bacteriologist. She worked at Columbia University and helped create the first polio vaccine. She worked on several other things like tuberculosis and on the original, not the original, but on expanding the availability and how to make penicillin. And so she did a number of things. But vaccines are one thing that I know when a new vaccine came out, we just checked whether or not I was still immune to measles, because I heard something on the news that said if you got your vaccine before 1970, your vaccine might not be as effective. So we checked, and because I'm sure I was in a class full of kids with measles, I never contracted it, but I did get the vaccine either the day it came out or even before. I had the immunity, but I wanted to check.
Sure.
What is going on with these anti-vaxxers?
You know, it is really amazing. You know, the first thing is we've got this time during this day and age really the best vaccines. I mean, even to think about the number of vaccines that we have, that have come out over the last couple of years especially, it's remarkable that we're in this place today that we can prevent these childhood illnesses that were killers. I mean, it's amazing. But what I don't understand is this anti-science movement, because we've got the best medicine, the best evidence that says this is the right thing to do, and yet, what's turning this around is things on the internet in a very negative way, and people are not getting vaccinated.
Well, but Jenny McCarthy says not to. So is there a reason that I should listen to my doctor rather than Jenny McCarthy?
Well, that's the thing. We are really struggling today with how we can diffuse information effectively when there's so much out there around the internet, there's so much on social media, and yet for whatever reason, parents are not listening to the tried and true place to get health information, and that's their doctors.
But I take serious issue that social media and internet. I blame a lot of really stupid, manipulative politicians who are spreading disinformation from their official capacity. I mean, all the crap we've seen about, quote, legitimate rape, and we even had a state senator from just north of us in Plano stand on the well of this Texas Senate and state that rape kits can prevent pregnancy from rape.
You mean they can't?
I mean, I blame a lot of that. They get a lot more high profile, and they come with some sort of authority, I guess. But it's just nuts to me.
I'm not sure when all this started, but it sure kicked into high gear during the last presidential campaign. Rick Perry had just mandated that all Texas school girls get Gardasil, which prevents HPV, human papillomavirus, which causes cervical cancer. First time we have a vaccine proven to prevent cancer. And for some reason, Rick Perry, of all governors, was the first one to come out, and not for some reason, but that was also for political reasons. But to use against him,
he was getting his little pocket.
Yeah, we understand that.
I think.
Yeah, but this is the thing. It was a landmark. It was out in front. But we have vaccines that we've had for a long, long time that are conditioned for school. So there was nothing unusual necessarily about having the vaccine as a requirement for school. What was different about this vaccine, I think, is it was about sex, and people were still very uncomfortable about the idea of associating a vaccine with something that's associated with sexual practices.
Where you're supposed to put your hands over your ears in front of the children and not even speak it.
Right.
Instead of saying, this is something you got to do, we're at the doctor's office, it's a vaccine, who cares, you don't have to explain it to the kid, you just have to get it.
Well, and that was part of the discussion with that one, wasn't it? That how am I going to explain this to my child? And I was thinking, you explain it that it prevents the human papillomavirus, which causes cervical cancer.
Right. Right. Exactly.
And we want you to be protected because I love you.
What's so difficult about that? But, that's not...
Part of what's difficult about that was I just said some very big words.
You did. Everyone take note.
But I think that when you're talking about the politics, I do think you're right, that there is something that's today that's very polarizing around the political climate. And I think what ultimately is happening is there's an exploitation of fear, and we are exploiting our innate fears in order, for political gain. And the result of that is this inflection against science. And that's a real problem where we're headed.
I think it is too, and it's against education as well. Because some of this is such basic stuff. I mean, to say that a rape kit can prevent pregnancy, I mean, that's insane. You can't even get there by any sort of scientific method.
Exactly.
It's so basic.
So the challenge for us scientists today is how do we talk to people in this environment knowing that things like evidence-based or the literature tells us or science tells us isn't going to work? Because we're going to compete with the email that was just sent to somebody about this and that, as opposed to the decades of school we went through in order to understand these concepts that we're talking to people about.
Right. So I have kind of a question, though, about measles. When kids get together and they're not vaccinated, are these viruses that we thought we've kind of killed off? They're just really living out there in places and available if you don't have protections and your shields up. are just waiting to get you.
Oh, absolutely. You know, we've gotten a little complacent about how safe we really are, and I think this Ebola situation, which we'll talk about in a little bit, is a good example of the reality. And yes, just because we hadn't seen any measles cases in the United States shouldn't have lulled us into believing that we were just perfectly safe and didn't need to vaccinate anymore. In fact, over the last couple of years, we've started to see more and more cases as people coming in from other places where they were not given the vaccines. And so, yes, it's still around us.
Okay, so where does measles, the virus, actually live when people aren't getting it? Because there had been no cases in Texas for a number of years.
They're on Key West having a drink.
Well, it's somewhere. No, usually what happens is it's introduced. What we're seeing in a lot of these clusters recently is people were going like on missionary trips in places where there was measles cases circulating. They bring the virus back into the United States, and what happens then, it's all a game of cards. It's probability. So if you're immune, you come into contact with it, you don't get sick. If you didn't get the vaccine, you come into contact, you're going to get sick. And that's how it works.
So it's kind of not surprising that the place that was ground zero for measles this time was Disneyland, because California has some of the laxest laws about getting vaccines. Say what you want about Texas, ours are much stricter.
That's right. You know, and I was reading about some of those schools in California that had up to 60% of kids opting out of vaccines in some classrooms. That's outrageous. That's absolutely outrageous. I think that there has to be a place for religious exemption. That should be there. But, you know, the ultimate thing we got to do is let's make sure that people who are lazy and just simply don't want to get the vaccine are just finding a way not to do it.
Now, one of the problems also is the cost of the vaccines. Are there any programs out there for people who can't afford them? Because, you know, when I was a kid, we got our smallpox and one or two others, the DPT for diphtheria, pertussis, and tetanus, and there were one or two others. But now there are a lot more.
There are a lot. Now, the good thing is we do have great Vaccines for Children programs around the country. Here in Dallas, we do have a great program at the health department. So it should never be that you don't have access to a vaccine because you can't afford it. The good news is there are programs available. They may not always be the easiest to access. Particularly, the worst time to access a public health clinic is the week before school starts every summer, because they will be lined up, and that's when they will get the vaccines. But there are programs available, so the vaccine should be available to everyone regardless of the ability to pay.
So if you've got a kid about to start school, you should get your vaccination at the health department like early, like June or July, and then you can be in the crowds at Target that last week before school.
Exactly.
Fighting for a school box.
Exactly.
But don't vaccines only work if you get them the week before school starts?
No, that is not true. You can get the vaccine and be covered, and even the flu vaccine will cover you through the whole season. There's nothing about waiting until later in the year. As soon as the vaccine's available, go and get it.
Let's talk about the flu vaccine a little bit, because one of the objections to getting it is an allergy to eggs, because the flu vaccine is incubated in eggs, and lots of people have an allergy to eggs, especially not when they're eating eggs with bacon and ham, but when they're having a flu vaccine. A lot of people just are allergic to eggs then. How serious is the reaction to the flu vaccine from people with eggs?
You know, the egg allergy and the flu vaccine is way overblown. Now, first thing, when we're asking people about getting a flu shot, whether or not you have an egg allergy, the next question we ask is, do you have cake or ice cream? And most of the time, people will say, yes, I can eat those things just fine. Well, that means that you don't have the egg allergy that would put you at risk for having a reaction to the flu shot. So keeping in mind, it is a very minute quantity, even though the virus is, the vaccine is incubated in a chick embryo, there's a very minute quantity of egg products, and so we don't ever see any egg reactions, from getting the shot, unless there was something else we didn't, get from the screening ahead of time.
One of the things, I have a number of food allergies, and food allergies tend to be cumulative. So if I have a little bit of soy, I don't get as much of a stomach ache as I do if I have a lot of soy. Would it be the same thing with an egg allergy? Like, I could get my flu vaccine and give up the cake and ice cream that day.
Well, you can still eat the cake and ice cream and eat it too. You know, the thing is, the rare circumstance where somebody's going to have a reaction to the flu vaccine because of an egg allergy, these are severe sensitive individuals who can't eat anything with an egg in it whatsoever. So no cake, no ice cream, and there are people out there. So there are people that are not candidates for the flu vaccine, but they are so much fewer and further between than those that really don't like scrambled eggs or don't enjoy a large amount of eggs, or they don't feel well after eating a lot of eggs. There's a very, very different allergy that we're talking about that would put you at risk for a reaction for the flu vaccine.
So isn't another reason that everybody needs to get vaccinated, unless you have an allergy to one of the ingredients in one of the vaccines, is to protect those people who can't be vaccinated, to protect children who are too young to have had all of their vaccines already. Isn't one of the reasons to not get the measles that measles can be deadly, especially for a kid under the age of 1?
That's exactly right. You know, vaccines were never, I mean, they do help the individual prevention. They do help somebody from getting sick, but the bigger indication and the bigger purpose is the community risk that is lowered by getting more people vaccinated. You know, the flu is the best example. There are people, like, for example, that are at higher risk for severe flu, those over the age of 65. Well, while they're our best candidates to get the vaccine, they actually don't have the best immune response to that vaccine itself. So, you know, if we want to really help the community, those that, like us, that are going to get a good immune response, we need to get that flu vaccine so we can protect those, say, that are over 65 from getting flu, because that vaccine's necessarily not going to work as well for them.
Before we take a break, there was a PSA that a number of doctors made, and I want to play it because it's brilliant.
I am a doctor.
I'm a doctor.
I'm a doctor.
I'm a doctor.
And I believe in vaccinations.
And I believe in vaccinations.
If you don't vaccinate your kids, it can endanger their lives.
The potential downsides of vaccinations are almost non-existent.
The cumulative scientific and medical communities are in absolute full agreement
that there is basically no reason not to vaccinate your kids.
No reason.
Which is why I cannot believe we have to make this PSA.
I thought we settled this in the 50s.
Hey, remember that time you got polio? No, you don't, because your parents got you vaccinated.
I did 4 years of undergrad, 4 years of medical school,
and 3 years of pediatric residency.
I had to go to school for 8 years.
I'm pretty sure I know what I'm talking about.
But you people still won't listen.
Now I have to use my only day off to talk to you idiots about vaccines?
I want to finish watching Breaking Bad.
I'm only halfway through the 2nd season.
But instead, I've got to come here
because you listened to some moron who read a forwarded email.
Perfect. All these people had to set up cameras, lights, sound equipment, so that I could tell you to do something we've been doing for a century. Look at all these people.
This is stupid.
Get your kids vaccinated.
Get your kids vaccinated.
Get your kids vaccinated.
Get your kids vaccinated or lose my number.
Get your kids vaccinated, or these doctors may never find out that Walt dies at the end of Breaking Bad.
Are you kidding me, dude?
Paid for by professionals who know what the hell they're talking about.
And you're listening to Lambda Weekly on... Well, Josh isn't here today, so I'm confused. I'm running the board myself. Stop laughing. You're listening to whatever this show is, and I'm whoever I am with Patti, and our guest is Carlo, who's the Executive Director of AIDS Arms. We're talking about idiots who refuse to get their kids vaccinated. Now, there is that exception that we were just talking about. People who really can't take a particular vaccine because it has something in it. Doc, you were asking a question that none of us quite got about something about what's in some vaccines.
Yeah, the vaccine itself.
Okay, so it's not so much that the vaccine is dangerous or not going to protect you, but that there's mercury in the vaccine itself. That's been a criticism. Is that what you're talking about?
That or something else that we don't even really know.
Well, we do know. Because we've created these vaccines out of pieces that we put together. We do know, don't we?
Right. This is not like fracking. These chemicals have been
tested. We know
tested.
about fracking, too, and don't get me started with that. We don't want to study fracking.
Sorry, it's a bad example.
Another show.
Bad example. But no,
undo.
So, look, the vaccines have been tested. You know, there is a whole methodology to making sure the vaccines, they have to be safe, because if you think about it, because we're in a world today where we don't have a lot of diseases, they have to be exquisitely safe, because any side effect, any reaction is going to be noted and not taken against a risk-benefit profile, because you just don't see measles, right? And so we are sure that you have to have a vaccine that's very, very safe, because we're also giving it to millions and billions of people. But we do that, and thankfully, we do not have bad side effects. We do not have reactions. We're all here as vaccinated adults, and we've done just fine.
Well, Doc isn't.
Oh.
Yes, he is, actually.
I can't even read Western food.
You have been in the Army. You are vaccinated. One of the criticisms, though, had to do with mercury. And the amount of mercury has been reduced, and the amount was never more than you get out of a can of tuna fish.
Right. Yeah, that was another overblown, unfortunately, situation. The thimerosal issue, which was the compound that had trace elements of mercury in it, that has been removed in these vaccines. And it's really, again, this has been studied very, very carefully. And none of the types of things that you would associate with mercury toxicity have ever been shown to be associated with a vaccine.
But, you know, people who will scream and complain and wail about this mercury, this trace amount of mercury, will eat, like, you know,
tuna fish,
Kraft American Singles, which is not even a food. It's a processed cheese. You know, I mean, quote, cheese. I mean, so, you know, or they eat at McDonald's, or they wear or they eat stuff out of a can or a box.
McDonald's won't even tell you what percentage of their hamburger patty is meat.
You know, but they'll eat all this other stuff, and there's just like,
yeah,
like 1 part per bazillion million.
Well, I think that this goes to a sort of a deeper thing that you know, we have a primal fear of infectious diseases, and I think there is something about the vaccine itself. You know, just the unknown. The injection, getting a needle, is a very scary thing, and I think it builds on that. It's a different set of sort of equations in somebody's internal clock. As to whether they're going to go eat a Big Mac or smoke a cigarette or drink a six-pack versus getting a shot. And there is something there that we have to figure out and understand about people as to why there is a fear of vaccines.
Okay, so Jimmy Kimmel, and he's the one who introduced that PSA that we played before the break. He had a great line. He said, you know, all of these anti-vaxxers, you know what they should do? They should all take up smoking, because it is only doctors recommending not to.
That's true. That's true.
Well, and you know, I think that's a good example. You know, public health officials have really struggled with this, and we try to toe the line to say, you know, the vaccine is safe. We urge everybody to get it. You know, these diseases are bad. You know, we don't take the hard line that is really put out.
I do,
as you do, and as Jimmy Kimmel did. And maybe it's something we need to think about as to sort of bridging that reality from science into what's capturing people's minds and attention.
It's called stupidity.
You know, whatever it is, we've got to do something to prevent people from not vaccinating.
Everything I can to lose a whole bunch of listeners today. And here at KNON, one of our mottos is, we don't care. No, it's that important to get vaccinated. Okay, so one of the questions that a lot of people have, and one of the fears they have, some vaccines are from a dead virus, and injecting parts of the dead virus will stimulate your immune system to create an immunity. Some viruses or some vaccines use a live virus, and I think that, not understanding that, is something that people fear.
But using the live virus is also to stimulate your immune system. I mean, all of it is kind of relying upon what's built into you to help protect you.
Explain how getting a vaccine using a live virus, and I don't have an example of one because I don't know which ones are which, but because I didn't read the email.
Right.
From Jenny McCarthy. But
you know, so okay, you know, ultimately you're right, Patty. The ultimate end game is to get immunity. And some diseases, in terms of how we've been able to get that immunity, work better when we take particles or pieces of the virus or bacteria. And others have worked better if we attenuate the virus or bacteria and allow that virus to just become into contact with your body, but then it doesn't cause illness. And so we have,
it's weakened enough that it doesn't.
It's right. It's called, in fact, the flu virus is called live attenuated. And this is a really elegant vaccine, by the way. It's the flu mist, the one that the kids get, that they put a spray up the nostrils. It's been attenuated so it won't grow or replicate at a temperature that's our body temperature. It only grows and replicates at the temperature outside of our bodies. So therefore it only will grow in the nose. But that's just enough for our body to say, hey, this is a foreign invader. I'm going to make my antibody to it, and then the virus will go away. I mean, they've done some really elegant things to make sure we've got good protection.
So when we're saying live virus, we really don't mean that we're injecting you with polio.
No.
We are not injecting you with the measles or typhoid or anything else.
Right.
Okay. So it's one of those things that it actually is a live virus, but
it's weakened. It's incredibly weakened.
Or it's been attenuated. I also like to think it's organic. There are those that like to eat organic produce. The live attenuated virus is an organic system. There's nothing artificial about it, and isn't that cool? You can actually generate immunity through something that's, another good example is how we eradicated smallpox. The classic story of the milkmaids weren't becoming sick with smallpox because they were exposed to something called cowpox, which was very similar. They'd get the pox on their hands, but they wouldn't get sick with smallpox. And that's what helped generate, ultimately, our weapons against smallpox. So these are the sorts of things we've been doing for a long time now in making sure that we can eradicate these pathogens.
My mother, who was a bacteriologist, one of the things that she worked on was tuberculosis. And while she was pregnant with me, they were doing their TB research. When I was a kid, we used to get a TB test in school, and I would always come out positive that showed I had TB, and always had to get a note showing that, no, I don't have TB, that I probably have an immunity to it.
Right.
So it's working that same sort of way. She had this exposure to minuscule amounts under the microscope,
right,
but it was just enough to stimulate
exactly
what comes out as a positive response.
Exactly.
But it was actually an immunity, because the TB test is looking for your immune system, or your antibodies.
That's right.
To it, not to.
That's right.
It's a measure of your body's response rather than.
Right.
Yeah.
That's right.
Which most people wouldn't have. What are some of the vaccines that some people, what are some of the vaccines that everybody should have, or all the vaccines that everybody should have?
Running the list, measles, mumps, rubella, MMR.
And that's one vaccine now.
Of course.
Yeah.
Polio, of course, still needs to be on the list. Thankfully, we're getting closer, although we're still managing to keep polio alive around this world in places where it's become destabilized. So, unfortunately, we still have a polio need. We have, a whole other set of hepatitis vaccines. So hepatitis A and hepatitis B, these are actually good for adults, particularly if you're traveling abroad. Really prevents exposure for those types of things. Healthcare workers get hepatitis B, of course. Gay men are also, it's recommended to get hepatitis A and B as a vaccine as a general preventive requirement. It's just a good idea. Meningitis, we have a great vaccine that helps prevent meningococcemia. I have trouble pronouncing that one.
That one's usually recommended especially for kids who are going to be living in a dorm.
That's right. Yep. College-age kids, people going military service, coming into tight quarters in your 20s puts risk at having a meningitis outbreak. So we've got this vaccine that actually works quite well in preventing that from happening. In fact, when you have an outbreak like that, the first thing you do is you start giving out the vaccine to everybody so that you can try to prevent the subsequent cases. So, you know, influenza, not, frankly, a great vaccine. We need better technologies here. Nobody likes to get the vaccine every year, and of course this year was a horrible match for the flu vaccine. Yeah. Only 23% effective thanks to a non-typed match. But again, a very safe vaccine, and one that, you know, it doesn't hurt to get it, and you know, if you can prevent one case of flu, hey, you know, I'll do it any day. So, you know,
and now your dog can get the flu vaccine.
That's right.
Your dogs and cats.
Canine influenza. You know, flu is a pretty prolific virus, and you know, especially in daycare centers for our dogs. That's a good idea to get your canine influenza.
Because imagine the amount, the boxes of tissue that you'd go through if your dog had the flu.
There is a pneumonia vaccine that's recommended for people over 60.
That's right. So yeah, there's also a pneumococcal vaccine, and it's actually some new vaccines that have come out against pneumonia. There's one for children, and there's one for adults over the age of 65, and there's one that's indicated also for individuals who are living with HIV. So there's a great vaccine that really can help prevent pneumonia, which can be very, very deadly, particularly in the elderly.
There's the HPV vaccine.
And the HPV, you know, that's a great vaccine too. You know, prevention of cervical cancer from the viruses that are known to cause cervical cancer. You know, that one is just a remarkable one, just given how effective it is at preventing the types of HPV that can cause cancer. And so, you know, it's an interesting vaccine because I think the best use for it is for somebody that's not going to get routine gynecological exams. So in other parts of the world, this vaccine is going to be a lifesaver because cervical cancer around the world is still a major killer of women.
Have we learned anything from that vaccine about preventing any other cancers, or do we have to find out first what's actually causing those cancers and we don't know what's causing them?
That's right. You know, cervical cancer is somewhat unique because we know there's a virus that causes most of the of those cancers, and it's not exclusive to cervical cancer. The anal cancer is also a risk. There is a anal cancer risk that's associated with this virus, and throat cancer as well. But it is sort of rare. The only other example would be hepatitis B in the relationship with liver cancer. You know, I think, you know, in our future we will find more, you know, viruses that relate to cancer, but this is
Do you know
probably
which one
the
I'm
big
thinking of? Is Kaposi sarcoma, which really was a very rare cancer until HIV came along and then started showing up. That one's caused by a virus.
That's right. That's right.
And I know we have good treatments for it, but any chance of prevention for that virus?
Well, you know, in that situation, it was really only manifest when and it still is manifest when somebody is severely immunocompromised. And I think that the approach has been really to remove whatever factors that are causing that immunocompromised state will you know, result in sort of removing that risk.
Like it's a virus that's just generally, it's widely there.
Right.
And as long as you have a healthy immune system, you're not going to contract
That's right.
it.
Yeah.
That's always struck me too when they first made this direct link between the HPV and cervical cancer, that, wow, you know, if tissues of various types are susceptible to converting to cancer cells as a result of contact with this virus, it's probably not going to be just cervical tissue. And so I kept thinking, wow, they should really vaccinate boys too. You know what I mean?
Yeah.
Because you don't know. I mean, 20 years from now, we could learn that, you know, well, that's, you know, HPV causes all kinds of cancer. Right. You know, if it causes one, what's the like scientific odds that it, you know, can affect other tissues the same way?
Well, yeah, absolutely right. And we did find that with anal cancer in men and women. But, you know, the other part to the equation, of course, is women will get HPV from men. And so really, it doesn't hurt to go ahead and remove the disease burden by vaccinating both populations. In fact, you know, models and studies show that when you do that, you actually lower the risk even further in the community, and it makes sense. You know, unfortunately, you know, genital warts are an incredibly common sexually transmitted infection. In fact, most people will get a wart in their life, and so let's use the vaccine that we have. Let's use the scientific breakthrough that we have and prevent that from happening.
It makes a ton of sense, but a lot of people don't see that way.
Let's go back to flu, because this is one thing I think a lot of people don't understand. This year's flu vaccine was not very effective because you were vaccinated for one type of flu, but that's not the flu that showed up. Are there just lots of flus out there? Does flu mutate? What happens with flu?
All of the above. You know, there are flu virus strains, you know, that number, you know, I can't even give you the number off the top of my head, but what happens is we commonly have 3 strains of flu viruses that circulate around the world, and every year there's about 6 laboratories that are studying the strains, trying to come up with what strains are likely to circulate into the upcoming year. And then it takes 6 months. We talked about the egg process. It is an incubation process, and it takes 6 months to make the vaccine. And so you have to have the strain that, you know, you're going to put into the vaccine and put it into production that much ahead of time. And unfortunately, this go around for the H3N2, which is the type A, one of the 3 that currently is circulating, it wasn't the right one, and we missed it. And so what that tells us is if you did get the vaccine, you could still get the H3N2 influenza infection, and unfortunately that particular one is known to have a little bit of more severe course, particularly in those that are over age 65.
Mm-hmm. So will we be vaccinated for that particular H3N2 next year?
You know, probably. Again, it's going to be, you know, you start over, you look at what's circulating. You know, the southern hemisphere kind of, it sort of follows the winter season. So when the southern hemisphere is experiencing winter, we hopefully will get a sense of what the strains are and then make the vaccine from that.
Okay, so here's my other question. Why is that? Because flu is not sensitive to the weather.
Yeah, you know, so what's really interesting, influenza by its name was coined by the Italians back in the 15th century, and influenza, as it means, was influence of the stars. And what the Italians discovered back then is, for whatever reason, the longer nights seem to herald the coming of influenza infections, which the longer nights are being in the wintertime. Mm-hmm. So the question is, why do we see flu seasons into the winter? We really don't know the answer to that. We think it's probably a factor of multiple things. The first is the fact that cooler temperatures and lower humidity tends to make the virus a little more hardy, so it seems to do a little better in lower humidities. It could be that we're in more tight, confined spaces in the wintertime. Our kids are in school. You know, classroom settings are socially dense, so it could be that we just tend to be more socially dense in the wintertime. It could have some aspect with sun exposure, although that's kind of a little further down the line, and I don't think we have good studies to really conclude on that yet. But it could be that vitamin D levels from exposure to the sun could be that it makes you more susceptible in the wintertime because you just don't see as much sunshine. Mm-hmm. Now, with that being said, we still see flu in the tropics. Mm-hmm. We see it you know, happens in places where it don't get very cold and still continue to have sun. So, you know, it's really anybody's guess as to why flu happens in the wintertime.
It's not that it migrates like birds.
Well, and you know, the other thing is there is migrations that happen. You know, birds do get influenza viruses and do carry it around the world. And so, you know, I don't think, you know, when we have this discussion where we are today and around the vaccines and all of the great things that we have, there's also the discussion, we have a lot more to learn, and flu is a great example of that. You know, we really don't yet know how we can, you know, curb these epidemics, these new pandemics that might emerge, and what all these new viruses, because we really don't have a full understanding of what causes flu in the first place.
We need to take a break. We're talking to Dr. John Carlo. He is the new U.S. Surgeon General, and okay, you're not. You're the executive.
Dallas Surgeon General. Go with that.
Yeah, well, Zach might not like that title either. He is the executive director of AIDS Arms, incoming president of Dallas County Medical Society.
A couple of years, yeah.
In a couple of years. Secretary Treasurer right now. We'll be back with more medical talk right after this.
This is Kimberly Truex of the GLBT Wedding Expo, and you're listening to Lambda Weekly on 89.3 KNON FM.
And this is Lambda Weekly. I'm Dave Taffet here in the studio with the late Patti Fink. I don't have your microphone on. That's okay. Now I do have your microphone on, John, and everybody here in the studio was just talking throughout the commercial because we have a whole other bunch of topics we were going to talk about. But let's wrap up the anti-vaccine thing with what you just asked.
Oh, I was just talking about the crazy Michelle Bachmann crap, you know, where she got up and made a speech basically declaring that childhood vaccines cause autism.
She said it during a debate, I think.
Yeah, and then it turns out she heard it from one anecdote from one person about they believe that their child had autism as a result of vaccines. So, I mean, here she's propagating this unsupported, you know, and clearly unscientific declaration, and people might actually believe something that Michelle Bachmann says.
Enough people voted for her. Yeah. What do you even have to say to
Well, you know, I think that there is some points to be made. You know, first that autism is really a terrible thing that we are seeing, and thankfully we are finding it when we are, and there are treatments that are available, you know, in terms of cognitive and behavioral therapy and those kinds of things. But I think that the big thing that is happening and how this equates to the vaccine is the association by time. And so when parents start noticing symptoms of autism, that tends to be around the same age that the vaccines are given. So there's a natural tendency to build the causality related to the chronology, and that's just simply not the case. You know, there's good studies that have shown that autism is not increased in those that are vaccinated versus the ones that don't vaccinate their children, or any of the order of the vaccines, or, you know, there's the latest that we've been, you know, contending with is not, you know, getting all the vaccines at once, and maybe dividing them up and lessening them over time and those kinds of things. I haven't seen any studies that would actually show that there's anything to show that that would be of benefit in reducing the risk to autism.
And it could, I mean, it could very well be, wow, it's the same time they're really getting out in the environment. So it could be an environmental factor. Lord knows we have pollution today, but some people deny that there's any change in climate.
Well, I mean, it could also be if it's something that you're born with and shows up between ages 1 and 2,
sure,
and your kid is vaccinated between ages 1 and 2.
Ta-da!
Same things are happening at the same time, but you're born with one, and they have nothing to do with each other.
And then there's the whole, you know, I think processed foods, all the chemicals dumped into foods, are going to show up in some form. I mean, it has to. We've been eating that kind of crap all our lives, you know.
Well, I think you're right. It could be any of it could be that there was some exposure, there was something. It's something we don't know about that happened either even before the child was born, or, you know, somewhere along the development and just is showing up. There also is a factor that we're probably looking for it more, and so we're finding more cases of autism, and that's why the numbers are going up. But, you know, this is still a big unknown as to what it is that's causing this. It's certainly very concerning.
And there's not just one kind of autism either.
Right, and there's
a
spectrum.
Big
absolutely,
spectrum.
Absolutely. And so this is a place where we do have to pause and make sure that our messages are clear. You know, particularly when we talk about the vaccines being safe, we don't want to discount, you know, that parents who have children with autism, that they're going through some really tough times, and we're not trying to refute beliefs around what they believe their child has been exposed to and those kinds of things.
It's just that scientists have studied this and find no correlation.
Right. That's right.
It's a valid question. It's just not a valid answer.
That's right.
Let's go on to a couple of other things. Let's talk a little bit about PrEP. PrEP is taking 1 pill a day to prevent HIV. Explain how this came about, what it is a little bit.
Right. You know, the PrEP story is very interesting. Actually, I don't know if it's fully substantiated, but the rumor has it is the reason the studies were begun is because people were taking PrEP, you know, on their own, and in communities in the United States, they were taking HIV drugs as a way to prevent getting HIV, and science came along and created some really good studies to show that it actually does, in fact, work to prevent HIV infections. In fact, we've had now 3 great, large, multi-center trials around the world prospectively, which means, you know, looking forward, which is the best kind of study to have, showing that you can substantially reduce your risk to HIV, 96% if you're on the drug effectively, which is really, I mean, higher than any other intervention that we have. And so, you know, the science has given us another tool, and it's been approved for use, and it's there. The question now, I think, is how do we use it effectively?
And how do we use it effectively?
Well, so there's
that was a good question.
It's a valid question. So the challenge is we have to give it to those that are at highest risk to getting an HIV infection.
So this is not something that everybody needs to go on?
No, I don't believe so.
Okay, so who should?
Well, who should? Someone who is at risk. This is the broader question. Who's at risk for HIV? Okay. And we know in our communities, gay men are still at the highest risk. Here in Dallas, 75% of all new cases are in our gay men. And we also...
It just breaks my heart because we've had this messaging for so long now that, and people still are not heeding it. You know?
And we're missing it. And so that's something, that is clearly the indicator right there, is we're missing it. We're not getting the... whatever it is, it's still not working out. You know, as we're thinking about this, uniquely so, because it used to be children born from an HIV-positive mother, hemophiliacs, you know, heroin, drug abuse, still an issue, but not so much so. We have changed in terms of who's at risk in some areas, but we have not in others. And you're absolutely right. In the gay community, we're still missing out. That's where our biggest new infections are happening.
Yeah.
So some people are, they've been safe, they've been with partners who are positive for years, they're still negative. Do they need to be on this drug?
No, you know, I think that there are people, you know, that's a great example, what we call serodiscordant couples, you know, whereas one is living with HIV, let's say he's undetectable, he's been living with a partner who's negative, and they've been doing whatever they're doing to keep each other in that same status for 10 years or longer. Probably not indicated. You know, again, it needs to be worked through with the doctor and further education to see that. But you know, I think that the bigger risk is those that are, you know, out with multiple partners who are dating, as it's called, and are engaging in unsafe sex. You know, a lot of times substance use and alcohol and those kinds of things going along with it. You know, these are the areas where I think we've got to focus that intervention. And that's really the challenge, is because this is going to be the most difficult population to get on a single pill once a day regimen.
Now, I remember when PrEP first came out, it was one of those things I didn't want to talk to either side. One side was, everybody needs to be on this. You want to kill people if you don't want everybody on this. And the other side was, this is just giving people a license to have unprotected sex, and I can't believe that you're encouraging people to do that, and you just want to kill people. No, I just want to write a story about it. And I asked both sides, well, are there certain circumstances? And one of the ones I used is, somebody's in a long-term relationship, they break up, a partner passes away, all of a sudden somebody's thrown out into the dating world again for the first time in a number of years. Might that be somebody who really would be indicated for PrEP until he gets used to the idea of using condoms, using, you know, being safe, doing what he needs to do, getting into another relationship?
Yes, absolutely. You know, I think it has been an interesting discussion. It's been very polarizing. You know, HIV really goes hand in hand with activism. I mean, the whole reason we are here today with the discoveries of science and the pills that we have has been through the history of our activists that have done this to keep up this fight. From that passion becomes a lot of raw emotion that it really can create a division in this ranks. And this PrEP conversation has really made that very relevant.
So you're suggesting that especially a gay man living in Dallas might decide to discuss PrEP with his doctor rather than with an actress, and maybe have serious conversations with friends about whether or not to go on it, as opposed to reading just a forwarded email.
And you know, sorry, you guys who are actually friends with Jenny McCarthy.
Yeah. But she's mostly anti-vaccine. I'm not sure where she stands on PrEP.
I don't know where she stands on PrEP, but that'd be a good...
But that's why I just said asking an actress.
Right.
You know, there is a misperception on PrEP. You know, it's a program that somebody would need to be on in order to be on PrEP. And because, you know, it's not just about taking the pills. You'd need to see a doctor, you know, every 3 months, get your labs tested to make sure you don't have any liver or kidney problems. You need to be checked for other sexually transmitted infections. I think when you put somebody in that type of a situation, along the way, as a doctor, you're going to be talking about what's going on in their lives. Are they taking the right precautions? Are they being safe? I think that the PrEP program itself is probably even better than the biomedical intervention, because it makes somebody remember that, you know, that there is a risk out there, and it empowers people to take ownership of their own health, thereby making those visits and making sure they're doing the right thing. And studies have shown condom use goes up in young men that are going in those programs because they're talking to their doctor about sex and unsafe sex, and thinking about new ways to navigate away from those situations.
That's interesting. You do lay it out for someone to think it through and say, you know, suppose if you did message it, you know, such that this could save your life if you did this, and yet what they're really doing, it's like that vacuum thing. You're supposed to vacuum pants that you hook up to the vacuum cleaner and lose weight, but they say in the little book that say, well, if you do 10 sit-ups and 20 of these and 30 of these twice a day, you'll lose weight. Well, yeah, you don't need the vacuum cleaner pants to do that. If you just did the sit-ups, you would lose the weight, you know.
Right, but for us, it's whatever works, you know. And just like when we started this conversation, we are still missing the message, particularly in our younger gay men. And whatever we can do, you know, we know this by the other sexually transmitted infections, gonorrhea, syphilis, chlamydia, those things are just running quite prominent. So whatever we can do to help is going to be the right answer.
I want to talk a little bit about Ebola. There were lots of parallels between Ebola and HIV in the response to it. You know, fortunately, I was safe because I used to live in Oak Cliff, but all people in North Dallas were exposed to it. And
I drove by Presbyterian
You drove
Hospital.
by Presbyterian. I was on Central Expressway once, so chances are we're going to get Ebola, right?
Well, you know, it was haunting how the fear of the infection itself was so much bigger. And, you know, this whole system, the politics, the media, the anti-science, everything all converged here in Dallas on this poor individual, Mr. Duncan, and his family, as they went through this tragedy that was blown up across the world.
Yeah, part of the problem with the media was because it was this big international story, rather than sending health reporters to report on this, they sent their #1 star reporter who had no comprehension of what the county health director was talking about and no experience reporting on a health issue. That was part of it. And I'm being kind right now. My real answer is they wanted to sensationalize this. I was horrified. I never sit through press conferences with the Dallas media because I'm usually covering other types of things, and I did with this, and I've never been so embarrassed to be with other reporters. They were
that
horrible.
Stupid, right?
They were that stupid when it came to this. After a 30-minute explanation of what the virus is, what's being done to contain it, what's the you know, how contagious is it, and who needs to be quarantined. 30 minutes they were talking, and then the questions were like, wow, you didn't listen to a word he said, did you?
Yeah, you know, I don't think it was unique, unfortunately, to the reporters. I think that there was a large movement that just would not listen to any of what the science was telling us. You know, keeping an example is what happened in our school system. You know, they were considering district-wide closures, not because anybody with Ebola had walked into the school, because there was a parent who was an employee of Presbyterian and their child was in the school. Absolutely no scientific risk whatsoever, and yet they were considering a district-wide closure as a result of that. And,
but the problem was that if a kid went to a school in North Dallas, the schools have phones, and so a kid in Oak Cliff could catch it through the phone lines, right?
Well, or the worst one to me was
I mean, it's that stupid.
Was the teacher who flew in from Maine to some conference, I think in Grapevine, and then flew back, and they wanted to quarantine her
you know,
at home before she could return to work.
Whatever it is, I think we need to take this as a lesson learned, and I do think that there's parallel to the AIDS epidemic early on in the 80s when we didn't know what it was, and all of the fear. People were, not sharing toilet seats and doing all those other scary things about handling, people that had died, the bodies and those kinds of things, just tragic things, around suffering. We haven't really learned much as a result of that experience as we watched the Ebola situation unfold, and that family was not treated very well and continues to live with the consequences of having a risk of this threat that really spoke to us, I think, in a primal way.
Yeah,
it did.
We are out of time. John, I want to thank you for being with us and putting up with our rather bizarre way of asking questions.
And
it's my pleasure.
And I hope you'll come back for more fun.
Anytime. Thank you for having me.
And if you got anything out of this hour, remember, John's advice is listen to your local actress and email, because when it comes to health information, what do doctors know? Did I get that right, John?
Yeah. I'm going to leave you with that. I think you did fine.
Good. We'll be back with more Lambda Weekly next week.
Knon 89.3 FM in Dallas and Fort Worth, the voice of the people.
Business owners, tell KNON's listeners about your business. You can put your business or event on KNON. KNON currently has space available to run announcements for you. Tell KNON's listeners about your goods, services, nightclub, concert, or event. Help keep the voice of the people on the air while putting your information on the air. KNON's been named the #1 radio station in Dallas by both the Dallas Observer and D Magazine. Put your business with Dallas's #1 station. Call now for more information at 214-828-9500, extension 227. Or extension 233. For more information, go to knon.org and click on the Run Spots on KNON page. It's a great way for your business to support community radio while letting more people know about you.